By comparison, South Korea has 100% of its kids with high-speed internet. We got 20%, South Korea 100%. In a country where we expect free Wi-Fi with our coffee, why shouldn't we have it in our schools? Right? In places like Korea and Finland, where the education system is really doing well, teachers are paid at the level that doctors and engineers are paid. And it is respected as a profession.
South Korea, because they've done a good job on one side, but on the other side, tremendous problems at the beginning. They had tremendous problems and great numbers of deaths.
And so there's models like South Korea who took advantage of February, built up the testing capacity, and they were able to contact trace, and their infections have gone down, even without the type of shutdown that, because we're late, we're having to do. We should be able to get to a South Korea type prioritized testing thing within a few weeks.
South Korea tested more than 66,000 people within just 1 week of its first case of community transmission. South Korea has now tested more than 196,000 people, but we are not anywhere close to that. They started conducting drive-through testing, but people here in the United States can't even get tested by their own doctors. This is the United States of America. We're supposed to be leading the world. Instead, we are trailing far behind. How did South Korea test so many people so quickly, but we didn't even test a fraction of that number? I really want to get to South Korea and their 50 mobile testing sites that they've set up where people can just drive up, get a quick swab, get a test, and results in 2 days. And centers minimize interaction between patients. It helps mitigate the risk. And why haven't we set up these mobile labs? Are we planning to set them up?
CDC's role in this was we very rapidly, within almost 7 to 10 days, developed a test from an unknown pathogen once we had the sequence.
Yesterday, you celebrated that we had done more tests and more tests per capita even than South Korea. But you ignored the fact that they accomplished theirs at the beginning of the outbreak while we treaded water during February and March. And as a result, by March 6th, the U.S. had completed just 2,000 tests, whereas South Korea had conducted more than 140,000 tests. So partially as a result of that, they have 256 deaths and we have almost 80,000 deaths. I find our testing record nothing to celebrate whatsoever. The fact is their test numbers are going down, 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 down now.
I have a slide that I want to put up that shows what's happened in America since then. The chart, which is here, compares the experience of the United States and South Korea on 3 dates. On January 21, both nations experienced their first case of COVID-19. At that time, the unemployment rates in both countries were essentially identical. On March 3, when the witnesses were last here, South Korea had experienced 28 COVID-19 deaths and the U.S. had experienced 9. The economies of both nations, as measured by the unemployment rates, were nearly identical. But now the story changes. As of yesterday, more than 81,000 Americans have died, and the U.S. economy has experienced job losses not seen since the Great Depression. Meanwhile, the economy of South Korea has not changed dramatically at all, and the death toll is now at 256. South Korea is smaller than the United States, 1/6 of our population, but even if you bulk up the death toll to reflect the difference, the per capita death toll in the U.S. is more than 45 times the rate in South Korea. And the healthcare carnage here is causing a near depression while South Korea has protected its economy by managing correctly. The question is why? If we want to open up our economy and schools, we have to learn the lessons of nations that have managed this well. Here's some things that don't explain the difference. Our hospitals are as good or better than those in South Korea. Our healthcare providers, heroes, are as good or better than those in South Korea. Our research capacity is as good or better than that in South Korea. And we have more resources than South Korea. Our GDP is 12 times South Korea's, and our per capita income is 50% higher. The death rate in the United States, especially when compared with other nations, is unacceptable, isn't it? And the experience of South Korea shows that how a nation manages the healthcare crisis has a huge impact also on its economic condition. Isn't that the case? Get to that. I want to get to factors that do explain the difference, since we know it's not resources or our health providers. First is testing. South Korea began aggressive testing much earlier than the U.S. Now in the 5th month of the pandemic, we've surpassed South Korea in per capita testing, but in the critical month of March, South Korea was testing its population at a rate of 40 times the testing in the U.S. Admiral Gerard, Dr. Gerard, has set out the standard for us. When we get to September, he says the United States needs to do 40 to 50 million tests a month to be safe. That equates to about 1.3 million to 1.7 million tests a day. Yesterday, we did 395,000 tests. We've got a long way to go. A second factor is contact tracing. South Korea embraced a rigorous contact tracing program right from the beginning. The United States still has not engaged in a national contact tracing program. Isn't that right? That was key to the economy as well, because South Korea did testing, contact tracing, protect, serve, isolate the sick, and then they didn't have to do the shutdowns, which helped their economy. Social distancing is a third factor. We've talked about it, but finally the last one, healthcare systems. Would you agree with me that it helps keep people safer either from serious conditions or death from COVID-19 if they have access to healthcare? Of course that's the case. In South Korea, 97% of the population have health insurance. In the United States before COVID-19, millions didn't have it and lacked access to healthcare. The massive job losses in the last months threatened to take health insurance away from millions more.
It's South Korea as being the gold standard for testing, but as it stands, we are now testing at a higher rate per capita than South Korea. And in fact, as this chart is going to show you, in all 50 states, we are now testing at a higher rate per capita than South Korea. So a state in this country is testing at a higher rate per capita than the entire country of South Korea. That's pretty extraordinary, I would say.
He said, I think we are going in the right direction. But the right direction does not mean we have by any means total control of this outbreak. How does that square with the president's statement yesterday that we have prevailed over the outbreak?
Well, the president made clear he was talking about testing. The fact that we can say we're doing double that of any other country, the fact that we can put up that graph that shows South Korea as a small little red bar of testing per capita, and every bar beside it is an American state or territory outdoing what South Korea has done. And let's note that South Korea was the gold standard for testing. In fact, on March 13th, the Washington Post headline was, South Korea is doing 10,000 tests a day. The U.S. is struggling for even a small fraction of that. And here we are on May 11th with a Washington Post headline. The administration keeps bragging that the U.S. testing now is better than South Korea's was a month ago. So you can't demand that we reach South Korea and then say that we're bragging when we do. This administration mobilized that testing. Every state is better off than South Korea at this moment. And that is a very good thing and something to be celebrated because it's American innovation at its best.